Unpreparedness of the government has put thousands of lives in jeopardy. When the nation got showcased as the pharmacy of the world, the government's callousness kicked in to make a profitable search in themselves rather than controlling the mess of health infrastructure and the economy of the country. As India was declared a victorious precinct of the coronavirus, the officials and health experts neglected the threat of the forthcoming second wave. The fragilities in the healthcare system got exposed within 3 months of excruciation from the tormenting times. Last year, the Indian economy reported a record-breaking recession of all times as the GDP shrank 23.9%. However, the sluggish arrogancy of the government played its toll in making the experts and analysts anticipate a recovery growth of 10 to 12% during fiscal year of 2022. The idea was the statement issued by the government to keep the hopes of the citizens high in one or the other sense. It declared that India had gained momentum in dwindling the virus. The ill-planned structure of the Indian economy had made the roadmap to recovery impossible as it incepted more cracks as we went further ahead. Renowned and prestigious organizations like the International Monetary Fund and the World Bank declined their estimations for FY 2022 as they had acquired knowledge about the mounting threat on the Indian contingent. The government shut its eyes to welcome suggestions from the rest of the world, and it has cost the nation a hell of a lot more. According to a report published by CMIE, 9.9 million people were either furloughed from their jobs or had to force out themselves due to constrained pressures of upheaving their incomes. The data showcased the figures for the first quarter of 2021. April was one of the most tormenting times for the Indian unemployment rates as 7.3 million people got registered standalone during the month. According to another survey reported by Pew Research 2020, witnessed middle-class families downgrade to the lower income bracket due to uncertainty over the resumption of industrial activities. The economic disparity reflected even more as the big corporates continue to slush their accounts with hefty income. Around 70% of the population belonging to the middle-class communities were disregarded for the benefits by the Indian government and the finance ministry. Its propagated way into the economic crisis subsequently was known as the inequality virus. The Indian economy simmering down gets overseen as the bizarre moment in the history of the nation. The manufacturing sector is shrinking to become non-existent, while the service sector is holding onus on the fringes of temporary demand. If things don't revamp eminently in the forthcoming months, the clamoring could evade with lockdown proposal going fully fledged into action. Even if the employers go on a rising search to recruit employees, the unpredictable nature of another stall will revolve around our consciousness. Although there are sectors where there is an urgent need for recruiters, the medical staff, pandemics, nurses and doctors, the procedure is quite compelling and requires years of prudent training to achieve or attract the staff members. A proleptic instance of the government's hubris is the development of Central Vista in New Delhi. It has not only degraded lives in jeopardy but has also shed off hundreds of trees for the mere purpose of building their statutory premises. The ill-preparedness of the government and the insensitive rationalizing of decisions towards the industry has seen India attain 177th position in an international ranking of countries for environmental performance. If the reality of the healthcare system in India is appalling, then the unemployment scenario in the economy will crumble many hearts into pieces. A humanitarian crisis of astounding proportion and weakened stage of the crippling economy, enforced by the government's misinterpretation, has put the overwhelming Indians into a contradiction. Whether to save their lives or ease their economic troubles, third wave is inevitable, and neither the health infrastructure nor the economy has the potency or the resources to combat the ongoing crisis.